Vitamins E and K, what do they stand for? What do they do for our well-being? Why do we need them? What nutrients are they readily available in? Those questions and much more information will be answered by Dr. Lalita Kaul, who is a well-known teaching professor at Howard University College of Medicine. The moderator here on this set is Dr. Shambhu Banik. Let's look, let's learn, let's listen.
Good morning. Welcome to Global Television Network's Women's Worldviews Health and Nutrition segment. This morning, we are very pleased to have Professor Lalita Kaul, a well-known professor of nutrition in Howard University. This morning, she will be talking on vitamin E and K. Professor Kaul, welcome to Global Television Network's Women's Worldviews Health and Nutrition program.
Thank you. It's a pleasure being here.
Now, tell us what is the importance of vitamin E and K.
Okay, let's talk about vitamin E first. It has a very important function in the body as an antioxidant. The way vitamin E was discovered, of course, we always have first studies in the rats before you go to humans, and the studies show the deficiency of vitamin E caused reproduction problem. The female rats could not carry the babies to term, and the males became sterile. But the later on studies in the humans showed that it's very important in antioxidant. That means preventing from rancidity or breaking it up. For example, when we take unsaturated fats, and as I told you in one of my segments, that unsaturated fats are double bond. And we have monounsaturated oil, which is olive oil, which is very good, or other oils. But what happens is, to give you the example, is vitamin E prevents if that bond breaks down, there are radicals formation. That means little dots. The bond is broken, either high heat or something, and it's the vitamin E which will prevent the oxidation. And similarly in the body, vitamin E acts as an antioxidant in the cells in the body. So vitamin E is very important function in the body. Yes.
From where we can get vitamin E? What are the sources of vitamin E?
First of all, let me tell you, vitamin E, you will not see deficiency, you see rarely, because we have bacteria, we have good and bad bacteria in our intestines, and they synthesize vitamin E. And the other thing about vitamin E is, even though it's a fat soluble vitamin, you very rarely see toxicity as opposed to A and D. So the sources are your vegetable oils, wheat germ. These are the major sources of vitamin E, and some from fruits and vegetables. And it requires in the body for absorption, it requires fat and the bile acid. If a person has problem with gallbladder or pancreas, the duct will not produce enough bile to bind it. So any disease, that's why vitamin E deficiency can be primary or secondary. Mostly I will say secondary, because in normal healthy people we just make enough. And so, but primary has some people have part of their stomach removed, some gastric problem, or they are not absorbing fat, so it's getting malabsorbed. So of course, your physician, he or she will decide whether it's only vitamin E or all the fat soluble vitamins having problem. Now newborns, when they are born, they have vitamin E deficiency because their gut is so pure, no bacteria. But as soon as they start, even few days, the bacteria develops and vitamin E comes. But of course, again, the pediatrician, if he or she thinks there is deficiency, they will give drops of that.
How about gallbladder being removed? Does it affect vitamin E absorption?
It will. I mean, if the gallbladder is removed, in fact, I was only yesterday talking to somebody, and I had gone where they had invited me to do some nutrition counseling. So this person was saying she eats big heavy meal and she has to go to bathroom. And I was taking little medical history from her. She says her gallbladder has been removed. I said, you know, once you remove the gallbladder, you cannot digest fat. And that's going to be a problem. That's why you get into this problem. So you have to take modified low fat, probably not all. And I gave her some suggestions. Yes, persons whose gallbladder is removed, they are not digesting fat, and the physician or healthcare provider has to decide what kind of vitamin supplements to give, which will have all the fat soluble vitamins in them.
Now, let us touch on vitamin K or vitamin K.
Yes. Yeah. Vitamin K is again fat soluble vitamin, but hypervitaminosis is rare. That means if you have toxicity, it will not. Vitamin K, there are K1, K2, K3, different kinds of vitamins. In fact, when a newborn infant is born, sometimes they might give a drop of it. I don't know how the practice it used to be like that. Vitamin K's most important function in the body is clotting of the blood, forming of prothrombin. Prothrombin is a clotting factor. You must have noticed that when you fall down, you cut and the blood comes out, and then after a while it starts clotting, you know, a thick layer, and then you probably put a Band-Aid or antibiotic so that no infection. So this is a mechanism of clotting. We just see it in one split second, it just thickens, clots, but this is a process going on. If a person has a vitamin K deficiency, in that case the clotting factor will take longer time, and there will some cases there can be hemorrhaging, they can bleed for a long time. Now again, the most important things I tell in my lectures or my students is vitamin K is people who are taking, a lot of people are taking anticoagulant medications, Plavix or other medicines, and those people, they are keeping it empty, they don't want any clotting, any means very little clotting, so that the clot doesn't go to the heart and give a heart attack. Especially they give in if they have a bypass surgery, stent, or if there is a blockage person has, mostly elderly people have to take it. But very rarely they get the instructions that they should not do taking zero vitamin K, because we need some clotting, but they should not take green leafy vegetables or spinach to add it. So it's very important notice you have to give to the patient, physician, if not physician, somebody else. So when I take the history of patients, if they are anticoagulant medication, I ask them, what do you take in the diet? But I like spinach. I said, well, you cannot take it, because what will happen is your blood will start clotting, and that's what the doctor wants to do. They don't want blood to clot. Now, of course, if you have deficiency of prothrombin or vitamin K, bacteria is not making it, then hemorrhaging, there is such a thing as hemorrhaging, and it takes longer time. And of course, the physician with tests will find out. Usually in the test, they give you prothrombin time, you know, how much it takes to clot. So it will vary. They always give a reference as an age group, you know, at this age, this much should be there. So vitamin K, it's not that deficient in generally, but on anticoagulant and prothrombin, it plays an important role.
Dr. Kaul, how about a person who is on Geralto?
On?
Geralto, that is anticoagulant, you know, will that person also have to be very careful about eating spinach or things like that?
Yes, yes. I mean, nothing will happen, you took once or twice, but they have to be careful. Because say person like me, if I had to go, I just have to have everyday green leafy vegetable. Yes, because you are getting some vitamin K from your intestinal, but then if you need some for a little clotting, but you don't want over clotting, and that's what the doctors are preventing. You don't have a clot going to your heart and have an MI. And this is the one factor, because everything we add to the care of ourselves cause better quality of life. These things we didn't know many years ago, and that's what is causing the longevity, and people even with bypass and heart transplant and are living longer. I have a friend, he had a 30 years ago heart transplant, he's still living, but he's taking precaution, all these things. So these things, now the Americans live 80 years, Indians 62, where we was at one time 35 was Indian span. Yeah.
What are the sources of vitamin E and K?
E, I told you, the vegetable oils, wheat germ.
What are the vegetable oils primarily? The Indian community, all the Indian audience are watching, what kind of vegetables they should use?
All oils in general, but to keeping in account the heart and all that, like canola oil is good. It has a lot of unsaturated for cooking and frying, that's the good.
How about olive oil?
Olive oil is very good, but some people don't like the taste of it, you know. You go to Europe, as you must have gone many times, they just give you oil and bread. I'm not used to that, I'm used to having butter. But it's okay, with little bit digression is okay. We have to enjoy life too. We cannot be every time watching.
Correct.
But you should have in the kitchen two oils, canola oil. So that is if you are doing deep frying, because the smoking point is higher. It won't. But the olive oil is good for sauteing. You can put few drops, saute it for salads. So have two oils in there. Now they have even butter made from olive oil. If you don't like olive oil to dip your butter, you can use on that. So every little bit of, you know, prevention makes the whole big difference in the body.
Dr. Kaul, during your presentation on vitamin D and K, you talked about antioxidant. That has generated a lot of interest in the entire human race. You know, could you enlighten our viewers about antioxidant? What is antioxidant? Why it is so important? And what are the sources from Indian community to get antioxidants?
You can antioxidants from the fruits. You know, berries are the best, and all kind of strawberry, blueberry, raspberry, all berries are very good.
Blackberries?
And yes, antioxidant, especially for diabetics. When they ask me what fruit should I take, I said take a cup of berries every day. So antioxidant, the cells in the body stay healthy, there is no oxidation. That's why from the food is the berries group is very, very important.
How that does help, the antioxidant?
It prevents the radical formation, as I said.
That's one to hear that.
Yeah, radical formation. When we have in the body, what happens if there is no oxidative activity, the epithelial cells will break down. They'll start getting bruising. And sometimes the physicians might not immediately know, oh well, you don't have antioxidants, you are bruising. But of course, as investigative people, they have to find out what it is. So vitamin E plays a very important role in the epithelial tissues. So if there is no oxidation taking place, there are too much oxidation going back, and there are no antioxidant, then the epithelial cells in the cell itself, in the bone marrow, which is very important function of vitamin E, is antioxidation of the cells in the bone marrow. So it will start disintegrating. So that's
we
why
have
the
got 30 seconds left. So I want you to summarize in 30 seconds about vitamin E and K. Quickly.
Vitamin A, E and K are very important in our body, even though we may not need it from diet, because our gut synthesizes them, but however, if there is problem with the gut or the fat absorption, there will be a deficiency. Vitamin E is very important antioxidant vitamin to keep the integrity of epithelial cells. Vitamin K is very important in the making of prothrombin, which coagulates the blood, and people on anti-coagulant should not take vitamin K.
Thank you very much,
Thank you.
Professor Kaul, for enlightening us on these two important vitamins. Thank you.
Thank you.